We are joined now by Dr. Paul Chung, the chair of the Pediatric Policy Council. Good morning.
Morning, how are you?
I'm great, thanks for joining us.
Thank you for having me.
Well, let's talk a little bit about some of the challenges currently facing advocacy and public policy when it comes to child health.
There are so many. I think if you wanted to divvy it up into a couple of buckets,
Okay.
there are really sort of two big buckets. The first big bucket is how are children going to fit within the Affordable Care Act? The Affordable Care Act was never really designed to be about or for children. Sort of children are just sort of on the periphery of it, but it has a lot of impacts. And probably first and foremost is the Child Health Insurance Program, which covers an enormous number of low-income kids. And technically, in the Affordable Care Act, it's actually it might, at least theoretically, become irrelevant in the sense that these kids could potentially all go into the insurance exchanges.
Okay.
But there's lots of problems with that nobody really thought that carefully about. And the insurance exchanges in many ways are a lot worse than the insurance that is currently provided through CHIP. Mm-hmm. And so there are so many different sort of specific things that need to be worked out before you can safely transition kids from CHIP into the insurance exchanges. And that's just one of the issues. There are a number of other issues, actually one of which we'll be sort of addressing in our session this afternoon. But the issue of accountable care organizations and new payment systems and new care systems that are all focused on adults, but which are also going to end up applying to kids. And how does this work for kids who are chronically ill, who have serious complex diseases that require all kinds of specialists and all kinds of other things? How does that all fit together into the new structures that are going to be created by the Affordable Care Act? So that's one big issue.
Huge.
It's huge.
I mean, is there something you can even put a time frame on that? That seems like such a huge issue to grapple with.
The time frame is as long as we can possibly make it.
Okay.
I think that the issue is that there is so much pressure to transition and so many things that we don't know yet, that trying to slow it down just enough to be able to work step by step and come up with plans is really important. And there are a number of government agencies and private organizations that are working furiously to try to make this happen, but there is still so much that needs to be done. So that's one big bucket. The second big bucket is what I think what we would just call non-defense discretionary spending. So that there's national defense,
Okay.
the pot of money for that,
Right.
and there's a pot of money for entitlements like Medicare and Social Security, and those you can't really touch. But the rest of it falls into this pot called non-defense discretionary spending, and that is always negotiable. And anytime you want to cut the federal budget, which is basically every year,
Right.
then you're always going to be aiming for that pot. Unfortunately, the spending that is in that pot is really all of the spending that we think of that typically helps children and families. So all of the supports, all of the food programs, the housing programs, and all of these things are really in that bucket. And so, in this country right now, there is so much anger and so much dissatisfaction, and families are struggling. And they don't entirely know why. And there are a lot of reasons having to do with the Great Recession and with just the job market and all of these things. But there's also the fact that these programs are on the edge. And these programs that are really responsible for supporting these children and families and making their lives a little bit easier and getting them through the next day. That these are all pretty much constantly at risk. So those are really kind of the big two issues facing children right now.
So tell me a little bit about this session that you're putting together.
Sure. So this session is called Medical Homes for Children with Medical Complexity. Now, children with medical complexity are about 3% of the population of kids, but they account for about 40% of Medicaid expenditures. So they are the sickest of the sick. And one question is, how do you come up with any kind of a comprehensive system that really does them justice, that potentially could save money long term in terms of medical cost savings, but also will actually improve their lives and do it in a way that's sensitive to families' and parents' needs? So and are there any kind of policy solutions or system solutions that you can think of? And so that is what the conference this afternoon is about. And we have 4 incredible speakers representing parents and families and researchers and health system folks, and we're really excited about it. So.
Well, I hate to say it, Dr. Chung, but we're out of time. I
Oh,
want to
no.
thank you. I know, we could talk for hours, but thank you so much for joining me. I appreciate it.
Appreciate it.